Hello, everyone. I'm Patty Pellikka, Editor-in-Chief of Journal of the American Society of Echocardiography. This is Author Spotlight for the month of June. And I'm happy to be joined today by the lead author of an interesting paper, Left Ventricular Trabeculation, Arrhythmogenic and Clinical Significance in Athletes. I'm joined by Dr. Giuseppe Di Gioia from Italy. Welcome.
Thank you very much. Thank you. I'm so happy to be here, and thank you very much for inviting me for discuss such an interesting topic.
Tell us a little bit about yourself.
Yes, so I'm a senior consultant cardiologist working since 2016 at the Institute of Sports Medicine and Science here in Rome. Our institute is focused on the evaluation of the elite athletes before the international events, so on pre-participation screening. We have the possibility to evaluate athletes practicing all different sporting disciplines with a comprehensive cardiological evaluation. And my research, my fields of research are about the ventricular adaptation to exercise. So the topic of our study, it's one of my major topic of interest.
You have an image that you can show us to tell us a little bit about what you're referring to in your paper on left ventricular trabeculation.
Yes, in our study, we focused on this topic that usually creates a lot of concern in sport medicine doctor and cardiologist that manages with the athletes. That is the hypertrabeculation. In our study, we wanted to include the definition of trabeculation as wider as possible in order to include the highest number of athletes. So we went through the single segment trabecula to the 3-4 segments trabeculation, including a complete involvement of the left ventricle. But in our study, we focused on athletes that not reached the JASE criteria. So it's a very common clinical issue that a sports medicine doctor can find in everyday clinical practice.
And the arrows on your image point to the various examples from your study.
Yes, in our study, so we have seen that most 1/3 of the athletes, the Olympic athletes, had this kind of trabeculation. To correctly identify the amount of the trabeculation and give to them a clinical significance and a longitudinal evaluation, I think that is very important to have a specific and concrete indication to follow in this kind of athletes.
This is a really interesting cohort, and you've assembled the electrocardiograms, exercise stress tests, and echocardiographic data for these Olympic athletes.
Yes, we collected almost 1,500 athletes in a period of almost 10 years, from the Olympic Games in London in 2012 to the last Olympic Games in Beijing 2022. And athletes practices all the different sporting disciplines, both the winter and the summer games. So we had the possibility to explore every single aspect of the exercise-induced cardiac remodeling on this topic.
I don't want to give away the punchline to your research because I would like our listeners to read your excellent article. But were you surprised by what you found?
Yes, we found that left ventricular trabeculation is a very common finding in athletes, because some type of ventricular trabeculation can be induced by some type of sports, like endurance sports. They are more frequent in male athletes, in Afro-Caribbean athletes, but luckily for athletes, this kind of trabeculation lost the clinical significance. So we found that athletes with hypertrabeculation had no long-term clinical events or had no long-term development of complicated arrhythmias. So it can consider it as benign. And in order to facilitate the clinical practice for physician, we decide to create a practical flowchart to use to better manage the hypertrabeculation in athletes.
Excellent. What are the next steps for your research?
Well, next steps, we believe that our future research will focus on high-risk athletes, those with family history of sudden cardiac death, those with arrhythmias, the athletes with syncope or pre-syncope during the effort, or those with left ventricular dysfunction. And also, we would like to have a multidisciplinary approach involving also genetic testing and a wider use of cardiac MRI, just to evaluate the influence of exercise, of continued training on this kind of morphology in high-risk athletes, and to better understand how to limit the exercise training, because in elite athletes, it can be very important.
Thank you for publishing this excellent article in JASE and for visiting with me today.
Thank you very much for inviting me.
I would like our readers also to check out the excellent accompanying editorial by Drs. Lander and Hoyt.